Hello everyone, welcome back to our YouTube channel. We are back with another amazing video to keep you fit and healthy. Today's video is about a very common problem which almost every other person is either at risk of it or going through because of unhealthy eating and lifestyle habits. Yes, as the title suggests, it is about type 2 diabetes. It gets very difficult sometimes to manage a problem like type 2 diabetes with daily life hassle. And this is the reason we are here today to give you some important health tips to manage your type 2 diabetes. So without wasting any more, let's jump into the video. But before starting the video, don't forget to give us a huge thumbs and hit the bell icon to stay tuned. Starting with the top 10 of the tips that we have got for you for today. Number 1 is eat less salt. If you are a diabetic, you need to be a little bit more careful with your diet. Salt is very crucial in this regard, and it is better to take salt with care as it increases the risk of heart stroke and diseases. There is also a chance of high blood pressure. It is recommended to take a maximum of 1 teaspoon of salt, that is 6 grams of salt, a day. Yeah, I know it's way too less, but no pain, no gain. If you want to be healthy, even with diabetes, there are a few steps that you must need to take as well. We all know that health is wealth. Moreover, you also need to be careful while having packaged food as it already contains salt. So it is suggested to always read the labels carefully and select the products which have salt in less amounts. The amazing way to keep track of your salt intake is to cook food yourself. It will help you to be creative with recipes and cooking methods. It is a great way to divert your mind from daily life stressors. Number 2 is eat less red and processed meat. Keeping a track of your meal must be hard in the beginning, but trust me, the results will be worth all the effort. In the process of cutting down the carbohydrates and switching to a healthy diet, there is a possibility that you might take large portions of meat to meet your appetite. But the problem is, it is not good to have red and processed meat in large quantities such as bacon, lamb, beef, ham, and sausages. I know you must be thinking then what to eat if you're not allowed to have salt, carbs, and processed meat. But don't worry, I have this sorted out for you. The best alternative for red and processed meat is fish, eggs, pulses, poultry like turkey and chicken, and unsalted nuts. Pulses are great for you like lentils, beans, and peas, as they are great alternatives for processed meat, and the best thing is it does not affect the blood glucose levels and make you full with small quantity. Other than pulses, fish is also considered a great source of omega-3 oil, which helps in protecting your heart, and it is found in oily fish like mackerel and salmon. According to healthcare practitioners, it is great to have 2 portions of oily fish in a week, but the portion can differ for every person according to their own personal needs. Number 3 is don't forget to keep moving. It is very important to exercise and keep yourself active, as it is equally important along with a healthy diet. It's not only beneficial to manage your diabetes, but it also helps to decrease the probability of heart disease. Exercise increases the amount of glucose needed by the muscle, which makes the muscles use the insulin more efficiently. It is recommended to do a moderate workout of at least 150 minutes a week. Exercise can be any activity that increases your heartbeat a little, fasten your breath, and make you feel warmer. It shouldn't be intense enough to not talk. You can break it down to 7 days a week for 10 minutes or 5 days a week for 30 minutes. Exercise does not always mean having heavy workouts, but it can be any physical activity that you like. For example, swimming, playing badminton, Zumba, yoga, or aerobics. There are a lot of mobile applications nowadays which actually help you maintain a good workout routine. Number 4 is to know what to do every day. Keep small goals for every day and try to achieve them. Make a list of those small self-care habits and stick it on the wall. It will give you a reminder, and you can always have a quick look if you have done all of these or not. This list should include things like taking medicines, which you should definitely take even if you're not feeling good or feel like you're all good. The medicines are always important, and try not to skip them. The list should also include things like moistening and teeth brushing in order to keep your teeth healthy. Also, it's good to keep a record of your blood sugar levels, as it will help you identify your blood sugar pattern to make it increase and decrease. The daily measure of blood sugar levels will help you understand your fluctuations, and you can then plan your diet and exercise routine accordingly. Number 5 is mental stability. Your mental stability is very much important when you are diagnosed with type 2 diabetes. I know the only question you will have now is how? How can we look after our mental health? Here are a few tips to keep yourself sane. Number 1, talk to the people diagnosed with diabetes 2. They can understand what you're going through, and it will make you feel better and a little lighter. Dealing with diabetes often gets overwhelming, and finding a diabetes support group online or in your community will help you deal with the emotional turmoil. Number 2, do not stress yourself out by searching things online and implementing several things simultaneously. It can be very overwhelming and stress-inducing. The key is to do one thing at a time. For example, trying to cut down salt, sugar, and carbs at a time will be harder. It is recommended to try one thing at a time. Number 3, if you are trying to work on your workout routine, try to speed up your game steadily. Start with 10 minutes a day and increase it gradually. You will soon achieve your target. Number 4, learn to enjoy and take a break. Try to make out time for what you like and love to do. It could be painting, playing with children, reading a book, gossiping with a friend, or hanging out with friends. Number 6 is a daily checkup. Daily checkups are very important, as being a diabetic, you are at greater risk of vision-related problems such as glaucoma, cataracts, and diabetic retinopathy. It is recommended to get your eyes and feet checked at least once in 3 months to prevent unexpected health problems. Yes, you heard it right. Your feet also need a regular checkup because there's a chance of nerve damage and reduced blood flow in the feet. Moreover, it is not good to ignore cuts, sores, swelling, calluses, redness, and blisters, as they can lead to serious infections. It is always better to prevent than cure if you notice any of these things, which do not start to heal on their own in some time. Sometimes it is also possible that you will feel pain or loss of sensation in your feet, which normally happens when you're diabetic. If you want to prevent problems related to your foot, then try to wash your feet daily with lukewarm water. Dry your feet properly. Soaking your feet might lead to dry skin, so it is better to avoid soaking your feet. And yes, don't forget to moisturize your ankles and feet with any moisturizer you like, but be careful that you do not put so much moisturizer between your toes, because extra buildup of moisturizer can lead to infections also. And the most important tip, do not go barefoot outdoor or indoor. Ophthalmologists and podiatrists are the practitioners you should consult for daily checkups. Also, do not ignore any symptoms related to kidney pain or heart rate. It is better to consult a physician if the problem persists. Number 7, keep your vaccines up to date. As I said earlier, also that prevention is better than cure. So here are a few vaccines that experts suggest to have if you are diagnosed with diabetes 2. Consult your physician and talk about these vaccines and get it as soon as possible. Some of the vaccines are listed below. Number 1 is the pneumonia vaccine. This usually have one shot, but you may require a booster shot if your age is 65 years or above. Number 2 is flu vaccine. It is good to prevent seasonal flu, and have vaccines beforehand, as flu is just additional stress when you're already dealing with so much. Number 3 is the hepatitis B vaccine. It is recommended for those who are younger than 60 years and haven't gotten the vaccine yet, and talk about it with your doctor. Your doctor may suggest some other vaccines, such as tetanus, which is given once every 10 years. Never take the vaccine recommendations lightly. Number 8 is to take care of your teeth. Who doesn't care about their teeth, as teeth are important to give a good impression to others, and most people notice your teeth before anything else. Strange, yeah? I found it weird too, but it is a fact. So being a diabetic, another thing you need to take care of is your teeth, as you're more likely to face problems related to gum infections. It is very much recommended to use fluoride toothpaste twice a day at least, and also floss your teeth once a day. If your gums look swollen or bleed, consult a dentist, and it is better to get your teeth checked at least twice a year. A good oral routine is very important to have a good and confident smile. Keep smiling. Number 9, take care of your alcohol consumption. If you often have alcohol and you are also diagnosed with type 2 diabetes, then you need to take care of your alcohol intake. Also, because alcohol can increase or decrease blood sugar levels depending on your food intake with alcohol. If you are used to alcohol and cannot completely omit the use of alcohol, then make sure to have it in moderation. For women and men who are older than 65 years, it is recommended to not have more than 1 drink in a day. For men, it is recommended to not have more than 2 drinks in a day. The biggest mistake people usually do is that they do not count their alcohol calories in their daily calorie count. The calories from alcohol also count. Number 10, try to control smoking. If you are used to smoking and are also diagnosed with type 2 diabetes, then it increases the risk of all the health-related issues higher, such as heart disease, kidney problems, feet problems, blood vessel disease, and nerve damage. Smoking also makes it difficult to exercise for some people, so it can also become a barrier to your healthy lifestyle. Try to omit or reduce the use of cigarettes as much as possible. That's all for today's video. We will soon come back with another video related to health and fitness, because all we want is to see you fit and healthy. If you are also in, then don't forget to hit the like button and subscribe to our channel. Till then, stay fit and healthy.